Over the last few years, we've spent a lot of our capital money and time on focusing on improving our inpatient environments, and that's continuing into this year. And we've got a couple of exciting developments really. One which is around our dementia assessment services. So currently Ward 24 at Airedale Hospital is planned to move over to the Linfield Mount site in a purpose-designed unit, which is our new dementia assessment ward, and that's due to open in August of this year. We're really excited about Daisy Hill House, our new intensive therapy centre that's opening in June of this year. This is again a purpose-designed and purpose-refurbished unit that is going to be available nationally for females who have got complex emotional distress and disorders. And this is an opportunity for us to market new services, to deliver what is pretty much one of a kind across the country, working in a very psychological therapy orientated way. So it's really important during the course of this year and moving forward that we work really closely with the local authority. And the local authority are focusing on their children's pathways and the redesign of children's pathways. So they're working alongside our health visitors and looking at co-location around children's centres and the streamlining of those pathways. So community nursing is one of the areas we're going to focus on this year. It's very much about working alongside our commissioning colleagues and our acute trust partners. So we've got a slightly different approach in Airedale and Craven than we have in Bradford, but basically this is about looking at our out-of-hours services, looking at our specialist community nursing services, looking at how they align with the intermediate care services that are provided in each of our acute trusts, and pulling together a new specification for community out-of-hours services. So over the last 12 months, we've been really focused on finding a different approach to how we involve service users, carers, how we engage our local community. And we've pulled all of this together under a work strand called You and Your Care. And there's a number of pieces of work that are falling out of that we're going to implement this year. So one of those developments is around a carers hub. So we're going to start thinking about how we use volunteers to support carers, how we provide information for carers, how we provide a real focus on a different area for carers to get support, help and respite. We're really keen and interested to develop opportunities for people with mental health problems to get back into employment. We're working as one of the national pilot sites with some joint funding. We've put in place a number of new employment workers and we've set ourselves a target of identifying 60 places in our local community, in local employers' workplaces for people with mental health problems. Smoke-free targets is a really key area for us as an organisation. People with severe and enduring mental health problems are far more likely to die earlier from smoke-related problems, from poor exercise, from the medication and the side effects and complexities associated with the medication they take. And as an organisation that's really keen to promote health and well-being, I think it's a very important statement that we move to a smoke-free inpatient environment. So across our 2 mental health sites from the 1st of July, we will be a smoke-free environment. And that means for patients, for visitors and for staff. What's really important in our plan for this year is that we really embed new ways of working for our community teams. So 1,300 of our community staff have got mobile technology now that they're getting used to, working with. So we'll be doing a lot of organisational development, team development work with community teams, getting them to think about their flow of work, their work patterns, how often they travel back to base, when they have team meetings, how they work on the go. And as part of that, it's really important that we start to gather baseline data, an important part of this year's rollout of agile working.